Transoral outlet reduction is one of the leading minimally invasive endoscopic procedures to reduce the gastrojejunal anastomosis post-Roux-en-Y gastric bypass. Now, there are several proposed suture patterns, such as the single purse string suture pattern, the interrupted pattern, and the double purse string suture pattern. We adopted the double purse string suture pattern, which utilizes two running sutures placed sequentially along the gastrojejunal anastomosis. That, in theory, would provide greater scaffolding and reinforcement along the gastrojejunal anastomosis. An increasing number of providers are performing the double purse string suture pattern, yet little is known about the associated adverse event rate, specifically with regards to stenosis. The reported post-TOR stenosis rate ranges from 0 to 5%. However, this data reflects the interrupted suture pattern and the single purse string suture pattern only. Therefore, we aim to determine the adverse event rate associated with the double purse string suture pattern of TOR and the potential predictors for stenosis. On retrospective analysis of our cohort of 129 patients who underwent the double purse string suture pattern of TOR, the adverse event rate was 17.1%, with a 13.2% rate of stenosis. When comparing the patients who developed stenosis to those who didn't, none of the baseline characteristics or procedural characteristics were predictive of stenosis. Given the high rate of stenosis, we proposed a treatment algorithm including endoscopic balloon dilation, as well as stents and stricturotomy, all of which were highlighted and outlined in Figure 1 of the paper. Of those who developed stenosis, 58.8% required endoscopic balloon dilation, while 41.2% required stent placement. Our study challenges the notion that the transoral outlet reduction procedure comes with minimal adverse events. The rate of stenosis encountered in 13% of our cohort brings the TOR procedure and specifically the double purse string suture pattern's safety profile into question. The aforementioned results encourage prospective studies to reassess the risk-benefit ratio and effectiveness of the double purse string suture pattern in comparison to other suture patterns currently in practice. The latter would ultimately guide physicians in implementing the suture pattern with the most favorable outcomes with regards to weight loss as well as safety profile. In conclusion, the double purse string suture pattern should not be used due to its high adverse event rate, procedural complexity, and lack of additional benefit.